Welcome! Today we'll look at the OneStim cardiac stimulator, which is the fifth in the lineup of cardiac diagnostic stimulators from Micropace. The OneStim is a wards-based portable device which can be used for overdrive pacing patients in cardiac wards. It can be used for cardiac stimulation in the EP lab. It can be used for transesophageal atrial pacing and recording in paediatric and emergency wards, and can also be used during device implantations. The OneStim can also be used to support device implantation. This is described in separate videos on the OneStim in pace mode. The OneStim has many applications around the hospital. Its intended purpose is to allow more detailed electrophysiological investigations in the wards, so you don't have to bring patients out of coronary care or post-surgery wards into the EP lab. For example, in the first 48 hours post-bypass surgery, patients often develop tachyarrhythmias. These could be narrow complex or broad complex, and the OneStim allows you to use the wires left in by the surgeon in the atrium and ventricle to perform basic EP studies and overdrive the tachycardia as appropriate. Its intended purpose is to allow more detailed electrophysiological investigations in the wards, so you don't have to bring patients out of coronary care or post-surgery wards into the EP lab. For example, in the first 48 hours post-bypass surgery, patients often develop tachyarrhythmias. These could be narrow complex or broad complex, and the OneStim allows you to use the wires left in by the surgeon in the atrium and ventricle to perform basic EP studies and overdrive the tachycardia as appropriate. We must say a few words about safety. We must appreciate that this is a diagnostic device capable of very aggressive cardiac stimulation. The OneStim must only be used by a qualified cardiologist or by staff under direct supervision of a qualified cardiologist. When connected to a patient, the device must be under constant supervision. Furthermore, when using this device, you must have three conditions. 1. The patient must also be connected to an external ECG monitor. 2. You must have a defibrillator ready for immediate use in case the patient develops dangerous arrhythmias. 3. You must have a temporary pacing wire available in case the patient requires urgent pacing. If the patient does become bradycardic or asystolic while connected to the OneStim, you must remember this device is not a life support device, and you will have to connect the patient to a temporary pacing box. This could take a few minutes, and while you're doing that, the OneStim offers two features which can help support the patient. First, you can use the urgent pace button. To use it, you press it down for 2 seconds, and it will start pacing immediately on all 4 channels. Hopefully one of those channels will be in the ventricle and can help support the patient. If the patient becomes asystolic and the OneStim battery is depleted or non-functional, the OneStim offers an emergency pacing channel at the bottom of the patient connection box. To use it, you disconnect your ventricular leads and put them in the emergency pacing channel. As soon as you have connected the circuit with the heart, it will start pacing immediately at 100 beats per minute. This emergency pacing channel is independent of the stimulator's function or its battery. It has its own battery, which lasts in the device for 5 years.